Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., Ph.D., in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm Melissa Batchelor, and today we're going to be talking about nurse scientists influencing health policy. So I'm joined today by Alison Hernandez and Carla McGarvey. So welcome, ladies.
Thank you.
So let's do some quick introductions. Alison, maybe tell us a little bit about you, and we'll go from there.
Absolutely. Well, thank you, Melissa, for having us. And like you said, I'm Alison Hernandez. I'm a registered nurse. I also have my PhD in nursing, and I'm currently a Health and Aging Policy Fellow, serving in Congresswoman Donna Shalala's office. And I like to say that I'm nursing for the nation this year on Capitol Hill.
Which is perfect in 2020 Year of the Nurse and Midwife.
Exactly.
And Carla?
Thank you for having me. I am Carla McGarvey. I am currently Congresswoman Donna Shalala's Legislative Director and Deputy Chief of Staff. And I've worked on the Hill for about 11 years now.
Okay, so welcome to both of you. So Alison, maybe you can tell us a little bit about how you got interested in the Health and Aging Policy Fellowship, and then we'll talk a little bit about your experience.
Absolutely. So like I mentioned, I'm a registered nurse. My background in terms of practice was in medical surgical trauma nursing, and then quickly decided after a couple of years of practice that I wanted to go to graduate school and pursue a research degree. I was always really interested in how we could use things like exercise and social engagement to improve the social and emotional health of older adults. And so I wanted to use that as my dissertation theme and really focus on more clinical type research. And during my PhD program, I started to get more interested in translational science and policy. I kept thinking, I read research articles that sort of end in this elusive, this will inform policy. And I asked myself, how? It seems that policy definitely affects everything we do. And I really wanted to learn more. Obviously, it was a little too late to change course in terms of my dissertation work, which again was mostly clinically focused, but I knew I wanted to learn more about policy. And so I very specifically looked for a postdoc that would give me that opportunity. And that's what brought me to Northwestern University in Chicago. They have this 2-year integrated postdoc fellowship called the Disability Policy Postdoc. And what it is 2 years, meaning the first is completely research-based at the university. So I got to take courses like health economics and health policy and learn about health services research, so studying how we deliver healthcare. And then the second year feeds into the Health and Aging Policy Fellowship, which sort of culminates in this hands-on experience of learning all about government and the legislative process. So that's kind of how I got to the Health and Aging Policy Fellowship. And I have to say that throughout each step, from kind of having the idea of, what is policy and how can we use research to influence it to where I am today, I'm really excited that I chose this path because I do think that more nurses and more nurse scientists need to have the tools to understand and have these conversations with people and students and their patients and their own community.
Well, you're preaching to the choir with me here. So maybe tell us a little bit about your experience on the Hill, and then we'll ask Carla what it's been like to work with a fellow.
Absolutely. Well, I have to preface that by saying that I absolutely love working on the Hill. I kind of came up with a little bit of a hospital analogy. I do feel that sometimes it is like working in a hospital because there's a lot going on, especially in the house side, I want to say. There's a lot of energy, things can change very quickly. And I think that really resonated with sort of my nurse self. And I do see it as sort of like us in Congress are a group of sort of diverse patient care expert clinicians that are trying to solve all these big issues. And, our nation or the nation are our patients. And that's kind of how I felt from the beginning. and how I still feel today. I have done so many interesting things. So things like staffing the Congresswoman during different hearings. Early on, pre-COVID, when we were still on the Hill, I got to staff her during the maternal and infant mortality hearing, which was really interesting. I got to prepare, her talking points and questions. I get to talk to constituents, which is kind of more on that one-on-one patient-nurse relationship kind of aside. I get to talk to different advocacy groups and staff the Congresswoman during those meetings. And I basically have been able to kind of run ground on all things health policy and healthcare within the office and learning from Carla. I've also gotten to write letters to government officials on different issues that are important for our constituents or that our constituents highlight for us. I get to find letters to add the Congresswoman and new legislation to add her to. And ultimately, the very exciting part is that we get to introduce legislation. So all of that to say that being on the Hill has been super exciting, and really the staff are the arms, ears, legs, head, neck of the member, and we're there to really facilitate the role of our member of Congress and make them look good and make their job excellent.
So Carla, maybe you can tell us a little bit about how you got to where you are and what it's been like to work with fellows.
Sure. So as I mentioned before, I've been on the Hill for about 11 years now, and I've worked both on the House and the Senate, all sort of bouncing back and forth a little bit. I was trained as a lawyer, and I practiced law for a short period of time, but that was not for me. And blessedly, there are many people on the Hill who fall into my category, a lot of sort of ex-lawyers. But I'd always been really interested in politics. After I decided I didn't want to practice law anymore, I worked on the Obama campaign in 2008. After that, I came to the Hill and sort of started pretty low level for somebody with a law degree, but moved up pretty quickly because I think because of the office I was in at the time and because I loved it. And there's a lot of action on the Hill and movement. So I started in the House. I worked for a member from Ohio, and then I worked for a member who's on the Ways and Means Committee from Northern California, Mike Thompson. And then I went over to the Senate side to work for Senator Nelson from Florida, and I worked for him for about 5 years. I started as his tax counsel. I had done healthcare policy and tax policy on the House side. I got kind of burnt out on doing both, and then went to do tax policy, and then sort of missed healthcare policy. There's actually a lot of overlap between the two, amazingly, and especially after the Affordable Care Act. And so I was around for the passage of the ACA. I worked for Senator Nelson for 5 years, as I mentioned. I was his tax counsel, and then I became deputy LD, and by LD, it's legislative director. And then I was his legislative director until he lost in 2018. After that, you were out of a job, but I had the benefit of knowing Florida well, and Donna Shalala had just won a seat in Miami. So she had an opening, and I decided to go back to the House. And I was excited to be a part of a team that was building an office from scratch, a new team. I was very excited to work for a former secretary. It's definitely a unique perspective, and to learn from her. And to be honest, she is her own best staffer in many cases, especially on health policy.
Yes.
So that's been a great learning experience. And she's wonderful to work for. She loves young people, which from her education work. And that's a nice bonus. And she has more energy than probably the youngest member of our staff. So that keeps us all very busy. And I've been with her since she started at the beginning of this Congress. Okay. And then I was going to talk about working with fellows. Was that the next step? Okay. And so in my time, I've worked with a number of fellows in all of the offices I've been in, and ranging from fellows from the Coast Guard to fellows from NASA to fellows from the AAAS, and some doctor fellows and nurse fellows. And so we were very excited to get a fellow in this office, and we were very, very excited to have Alison, because for many offices, fellows sort of have a pick of a number of places to go. So we tried to woo Alison to our office, and it did work. We were very excited to have a nurse. The Congresswoman has spent a lot of time on nursing issues, and as she will tell you, she has written the book on nursing, which is not an exaggeration. We did sort of feel like, or I have felt like, nurses have been underrepresented in Congress. And I also think that nurses have the skills that can translate to a benefit for congressional offices. Talking to constituents is probably pretty similar to talking to patients, explaining things. And so we felt that was a bonus in having a nurse fellow. And then Alison also went to the University of Miami and lived in Miami for a while. And that was a helpful part. She took the Congresswoman's class when you were an undergrad, right?
Yes.
On health policy. And so that was also a bonus. Yes, and so I've worked with a lot of fellows. Alison has been great. I think the most successful fellowships are where we can integrate the fellow into the staff as much as possible and essentially make them another staff member. Some of that is, learning as they go. But I think a lot of it has worked very well in our office, especially House offices, because they're so small and we sit so close together, and we can, under normal circumstances, we sit so close together. And we really just threw Alison in to learn. And I think she did an excellent job picking up everything in the first 3 months we were in the office, and then did an excellent job adjusting to the new realities of teleworking and working from home. But she's really been an extra staff member. And I think that's, if I were a fellow looking for an office, I would inquire about how much autonomy a fellow would have, how much ability they have to work as a staff member, but with the guidance of a legislative director or a legislative assistant helping them along the way. I think you can take ownership over your projects, and Alison has done that with the legislation that we are working on, and letters and all of those things. So those are some of my tips on working with fellows. But I think it's a great learning experience because staff learn from fellows as well. We learn about, if you're a Coast Guard, from the Coast Guard, we learn about ships. It depends on where you're coming from, but it's real world knowledge that, we don't always have, of how does a hospital system work on the ground. And Alison would mention sometimes when we treated a patient this way, we would put it in the system as this. And I can see why the hospital structured that now, because we're looking at the billing part of it or things like that. And then, we've asked Alison a million healthcare questions too. And should I get my flu shot? What shot should I get?
Yes.
Yeah, I think I led the fitness walk.
Yes. Yes.
So tell me, Alison, a little bit about how you picked your placement, and then what were some of the things that you worked on?
Sure. I'm glad you asked that question, because I was Carla did a great job sort of highlighting some of the connections I already have to the office through the Congresswoman, being that I was her student. She was my president at the University of Miami. I did take her class, which was probably the highlight of any student who went through the University of Miami. And she's so influential in the nursing community because she did write that Institute of Medicine report 2011, which was a report that got me through my PhD studies, thanks to a lot of the funding surrounding it. So I have to say that from why I chose the office I chose, that is, some of the most important reasons. I have to say that when we went through orientation and I was thinking that I did want a placement on the Hill, I was thinking about a couple different offices off the top of my head. But then we were at a meeting, actually, and we had staff from Ways and Means come to talk to us fellows coming in And she mentioned that the office of Congresswoman Donna Shalala was looking for a fellow that would cover healthcare. And I was so excited that I couldn't contain it, that I literally like put my hands up in the air. And I was like, oh my God, I need to connect, pick me. So I instantly emailed Carla, and I was really excited to have an opportunity to interview and also ultimately, you know, pick to be there, but also be chosen to be there, because who doesn't want to be in the office of Congresswoman Donna Shalala? So that's how I picked it. I also felt that my experience having lived in Miami for 8 years in her district and having still connections there to friends and family, and I'm bicultural, I'm bilingual, you know, I'm not from Miami, but I speak Spanish, and that's been a really great skill to use during this time. I never really, I mean, having a second language or speaking 2 languages is always great, but that's really been an asset, I think, in the office, being able to talk to people in Spanish and being able to translate things on paper. The district is 70% Hispanic or Latino, so it's really important that I can sort of relate to that culture. So those were kind of the main reasons, and obviously it's a phenomenal team. I think the fact that Carla integrated me so seamlessly and the staff was just so welcoming made my experience 100% easier, and I was brave to accept the challenges. Nervous, but it made me feel very brave and encouraged. So some of the stuff I worked on, which I feel at this point we worked on a lot because a lot has happened since 2020 started. But kind of COVID aside, I was really lucky to really kind of take command in charge of one bill in particular that was introduced prior to me starting, called the Protecting Seniors Through Immunization Act. And that bill, which is relevant to older adults in particular, is a bill that essentially reconciles Medicare Part B's vaccine side with Medicare Part D's vaccine side. And I can kind of explain a little more of how the bill works. But essentially, you know, we have thousands of people every year, especially older adults, who are dying of vaccine preventable disease. We spend millions of dollars in treating adults and older adults for these vaccine preventable disease, you know, flu, pneumonia. And so we have to find a way to make sure that there's no reason and no barrier to the access to this vaccination. So under Medicare Part B, older adults can get things like the flu vaccine and pneumonia vaccine at no charge. But under Medicare Part D, they have to usually have, there's a cost associated, and it can range. And so research has shown that even a $5 to $10 copay can really deter older adults who are living on fixed incomes to get a vaccine that could prevent a disease that can be not only costly, but, you know, can also cause severe illness or even death. So that's essentially what the bill does. It reconciles the fact that there won't be any cost on the Medicare Part D side. And I think Carla can give a little context about how the bill actually came to be of interest to our office and how it got started.
Yeah, and another thing is that Alison mentioned how it works, but it's sort of, it fixes a unique problem where if you are under 65 and you have insurance, that all recommended vaccines are covered without a copay from the Affordable Care Act. You turn 65 and then you go to get your shingles vaccine and it's $120 copay or something along those lines. I can't remember which vaccine has a copay. So it's fixing something for older adults that the rest of the population with health insurance already has. And we thought that was very important. And we started this before the pandemic, and it only became heightened about the need for preventable vaccines. I mean, for recommended vaccines for seniors when you have a pandemic that disproportionately hurts senior citizens. The bill actually came to our attention because a constituent had written in about it and said, they wrote in a letter, and I wish I still had it because we responded, but it was something along the lines of, please support this Senate bill introduced by Senator Hirono, and it does this and this. And I read it and I was like, that sounds like an excellent bill. I was like, I wonder if there's a House co-sponsor to it. And, you know, you're a freshman member of Congress. There's a lot of bills that have existed for a while. So it's sort of unique to find, you know, a bill that sort of didn't have ownership on the House side. But there was a Senate companion, or a Senate version of it. And so I reached out to Senator Hirono's office and said, who is anyone introducing this on the House side? And they said no. So we sort of took it and ran with it. It wasn't an idea we came up with on our own. And I don't know necessarily what prompted this constituent to write in about it, but it set the ball rolling for us to introduce the bill. We have 2 Republican co-sponsors and another Democrat who are our lead, and thanks to Alison, a number of co-sponsors. And that's how we started with the bill. And then the COVID pandemic hit, and it became an even more important piece of legislation. And we do like to actually take credit, because there was a provision it was in CARES, right, Alison?
Yes, CARES. Saying
that it's not exactly our bill, but it says it's something we pushed for, to have the COVID vaccine available without a copay.
Mm-hmm. So it'll be under Part B. Yeah. Exactly.
All right. Well, that's good news.
Yes, but we would like all vaccines to have no copay.
That's our goal. So, but yeah, it's been really cool, I guess, if that's a word, is to kind of learn how to gather co-sponsors and write with those dear colleagues we do internally, and have to sort of explain the bill to different people, and kind of work on building those relationships across offices. That is such an essential part, I think, of the work that Carla does every day, and that as staff we have to do, definitely to build rapport and trust and get that bill going. So I think we have over 50 co-sponsors, and we have an op-ed in the Hill about it. So that was really exciting that I got to be part of that.
Yeah. And that's such a great story of how, like, your constituents inform the office about, hey, here's this problem. And then you take it and, you know, it's like, what can we do? And, you know, I guess what people don't understand is, like, to change anything in within Medicare and the billing, it does take an act of Congress. So, you know,
right.
That's not an exaggeration, but, you know, even knowing that, you know, so you've talked a lot about the process and, you know, now the politics. So to me, I think it's also great to see, you know, bipartisan support working towards something that will help older adults and help Americans. And so I think that's awesome. And then when we did our pre-meeting, you also told me about some breaking news that hasn't happened quite yet, but maybe you'd like to introduce that.
Sure. Oh, yeah. Well, I'm personally also really proud of this project, and House resolution will be introducing later this month, I believe around the 22nd of September. So the National Association of Hispanic Nurses approached me in the office back in, I want to say, early February. They had visited our office, and they wanted us to work on a resolution that would highlight and celebrate Hispanic nurses on a particular day during Hispanic Heritage Month. And the idea, again, behind having these resolutions and these assigned days is to really highlight the work, intelligence, the grit that and the diversity that exists within nursing, and how important it is to have healthcare providers, clinicians, in this case, nurses that are from the Hispanic community. So it does exactly that. The idea is to celebrate Hispanic nurses, but to also hopefully, really importantly, attract new men and women from the Hispanic community to nursing. So we're introducing that resolution on, like I said, September 22nd. And I'm just very particularly excited about it because it is the year of the nurse. And as Carla and I have already mentioned, you know, I really feel charged with and passionate about this idea of really highlighting the work that nurses do. And we do possess the skills and knowledge already that are great for policymaking. And so just having a hand in introducing this resolution and highlighting the diversity in nursing is really, really important to me. And I think that hopefully one day when it's official, I can, kind of smile to myself and think, oh, I helped do that. Big or small, like that's part of a stepping stone towards celebrating and recognizing a lot of other things, a lot of maybe other major changes and bills that will come after that relate to diversity within the nursing workforce and continuing to provide that competent cultural care for all our citizens.
So that's the National Hispanic Nurses Day.
Yes, National Hispanic Nurses Day is I guess the official name. I mean, the only name so far we've come up with. But yeah, soon to be introduced.
Yeah. So I actually was listening we had a town hall yesterday at GW, and in our School of Public Health, we have a scientist who's doing workforce diversity work. And when you look at the Caucasian population, African American population, the least number of providers are Hispanic and I think Native American. So we do have a lot of work. We've done really well with the African American population, but we do need more diversity in our workforce to reflect the population that we're providing care for. So hopefully they'll come up with interventions and strategies and models that we can use to advance that. So I think that this resolution is a great addition. So what are next steps, both for you professionally
and for life, I guess?
Yes.
So next steps, definitely continue to learn. I think learning to speak and understand the legislative language and process is not something that I could do just in 1 year. I'm really excited that I'm going to be able to stay on the Hill for the next 3 months or the last quarter of the year. My fellowship has been extended. So that's really exciting because I think with the pandemic happening, the work became even more charged and felt even more important. And it made me realize that this is where I need to be now, and that, again, big or small, there's a lot of work to be done. So I'm very grateful to the Health and Aging Policy Fellowship for allowing me to stay on as a fellow for another 3 months, and for, of course, the office wanting me and accepting me to stay on. And yeah, I want to continue that work, and hopefully, fingers crossed, eyes and ears in the new Congress, there will be an opportunity to stay with Congresswoman Shalala and her staff as a full-time staffer and part of their team. So that's the ultimate goal. Yeah. And I will put a plug in for a sort of that's like my real job aspiration, on my personal sort of nursing, continuing to elevate and sort of empower nurses to step forward and learn about policy. Thanks to our communications workshop that we did with John Bellison, I was really inspired to hopefully start a blog. And I say hopefully because I haven't published anything yet, but I did buy my website domain, which is called Nursing for the Nation. So soon to be just a platform to sort of help just demystify the, again, policy-making process, and to invite nurses to feel a little more less intimidated or more open to have conversations. Again, forefront of healthcare delivery, 4 million nurses, and yet we're still, I still don't think we know enough and have enough stake in the healthcare policy world, and just in things that affect health and the people we help every day. So that's kind of what I'm planning to do, hopefully at the end of this year. And yeah, those are my plans.
Okay.
Yes, we're very hopeful that Alison will stay on in the next Congress. We have to make it to the next Congress, but we are hopeful about that too.
Okay. Well, thank you, ladies, for joining me today, and congratulations on all the great work that you've done. So thank you.
Thank you.
Thank you, Melissa.
Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., Ph.D., in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel, and if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.